The idea for a dedicated facial plastic surgery clinic really has been in the works ever since I joined the department. It's great to see that it's actually coming into fruition. In this clinic, we offer a full range of services in both facial reconstruction as well as facial aesthetics. These services include, but are not limited to, rhinoplasty, nasal reconstruction, facial aesthetics, facelift, brow lift, as well as facial trauma reconstruction and facial cancer reconstruction.
We have a good blend of both cosmetic and reconstructive experiences here. On the reconstructive side, it's amazing that we can give them the ability to function and to go back into the world and be themselves. It can really restore somebody's confidence and let them carry on and live a productive life.
In this clinic, we offer both non-invasive, minimally invasive, and surgical services. So we'll have the capability to do non-invasive services such as botox and fillers, as well as some in-clinic procedures. We obviously will be servicing patients who are looking for surgical restoration, surgical rejuvenation, or reconstruction as well.
We will evaluate anybody with a concern for hair loss. Some of these patients might be great candidates for hair transplant or PRP, and it's really in that initial evaluation that we can get a feel for what the underlying cause is and then decide whether or not patients would be a good transplant candidate, or maybe we should treat them medically because they may have an underlying inflammatory disorder that would need to be addressed.
As a physician, I view myself more as an educator. Because a majority of our services are elective in nature, our patients have the option on deciding whether or not this is something they want to pursue. The patients are becoming more and more so involved in the decision-making process. I think it's important, especially for us as physicians, to explain to the patients what the options are and what are the pros and cons of each treatment options, and allow the patients to actually make the most informed choices that they think will benefit them the most. Eventually, we will hopefully like to expand our services further. We are very fortunate to be able to recruit Dr. Cao to join us in this new endeavor, as well as multiple new staff members to join this clinic.
The most rewarding part for me is when patients come back for follow-up. They've got makeup on, they've done their hair, they feel so good about themselves. That's what keeps me coming to work every day.